I'm Yulin Schwen, Associate Editor of JAMA and JAMA Plus AI, and you are listening to JAMA Plus AI Conversations. My guests today are Drs. Molly Candon and Adam Shekrud. Dr. Molly Candon is an economist and an assistant professor of psychiatry and healthcare management at the University of Pennsylvania. And Dr. Adam Shekrud is the founder of a mental health startup called Spring Health. And they are here to talk about the importance of prioritizing mental illness by investing in digital health solutions. Welcome, Molly and Adam. So, Adam, my question is that mental health has always been an issue and it's started to gain some traction, but why do you think that there hasn't been as much investment in mental health across the United States?
It's a great question. We often say that mental health was the pandemic before the pandemic, right? I think that a lot of the challenges that we see today are not new and can largely be traced back to even the 80s, right? Even before the internet, before social media, before a variety of tailwinds that have kind of exacerbated workplace mental health issues. I would say when it comes to why is there some reluctance around the willingness to invest? I would say that the onus is on us really as academics and as developers of interventions to showcase the full value prop and to really be thoughtful about which value props will resonate. I think that one of the things I loved about Molly's article was really this call to action to highlight the value prop of mental health outside of just savings in healthcare costs or reducing spend through the health plan and factoring in things like productivity or absenteeism or employee retention. I think all of those things are great, but I think that companies or particularly the employers who are sponsoring these services are in very, very different positions and different mindsets when it comes to what kind of justification will resonate, right? And I think that there are some companies that believe in this maybe being the right thing, and that's why they would do it. I think there was a big wave of companies that did it during the pandemic because they felt like it was necessary to be able to do business during that period where everyone was working remotely. And then I think now there's a wave of employers that are doing it really because the health plan savings or the hard ROI rationale is really resonating with them. But I think that for me, there's the two main reasons of why have we generally been slow to adopt these things, I think is one, the evidence base has been inconsistent or has been positioned in a way that is not necessarily going to resonate with all employers.
So, Molly, your article in JAMA Network Open, Employer-Sponsored Digital Health Platforms for Mental Wellness, a Good Investment, speaks about the ROI and the value of these programs. Can you discuss a little bit of that?
Sure, and thanks for having me. Just to echo Adam, I think our hope is that employers would invest in mental wellness because it's the right thing to do. But at the end of the day, they need to see a return on investment, whether it be productivity, retention, organizational climate, and culture. But cost savings is perhaps the most proximal. And being able to demonstrate cost savings is notoriously difficult in mental health care. Historically, we've underspent on mental health care. And therefore, when you are introducing a new product or service, you are catching diagnoses, you're starting new treatments, and you're seeing an increase in spending, especially in the short term. Longer term studies have been able to demonstrate that year 2, year 3, you see cost savings. But there are very few studies that have been able to demonstrate cost savings right away. And that's what was so exciting about Adam's study. I would add that the value of mental health care is bigger than mental health. We often see physical health outcomes that improve after an investment in mental wellness. So for example, someone who has depression becomes more adherent to their beta blockers when they're treating their depression. And one of the exciting things about Adam's article is that they were able to demonstrate disproportionate value for folks who had comorbidities like gastrointestinal conditions. And this is exactly what we would expect. These are individuals who have an entire care plan that they're managing, and their mental health is just part of that. So if you can help the mental health piece, you can move the needle on some of these physical health outcomes. Unfortunately, from an evaluation standpoint, this often leads to the wrong pocket problem, which means the benefits of a treatment aren't attributed to the psychiatrist or the therapist or the primary care physician or nurse practitioner who's actually providing mental health care. We're seeing it accrue in other areas of the system. Being able to capture total cost of care is very important when it comes to demonstrating value.
From an industry perspective, one of the things that I usually encourage people to remember is that the vast majority of employers have already decided that they have to invest in mental health. And depending on which survey you read, about 96, 98% of American employers have already implemented an employee assistance program, which is kind of the front line or the first port of call when it comes to outpatient behavioral health services. And similarly, an overwhelming majority of employers also provide employer-sponsored healthcare through a health insurance company, which does include behavioral health services through some kind of behavioral health network that they manage or that they rent in. And so employers have overwhelmingly spoken that they do invest in behavioral health. I think that the key question is how much they invest and what value they get from those services. And often when you speak to employers about quote unquote willingness to invest in mental health, the conversation is generally not around do they want to invest. I think the answer is yes, and they overwhelmingly do. The question is, how do you want to invest and in what ways are you actually getting value from the programs that you've implemented? So many of these employee assistance programs that almost every employer has in place suffer from chronically poor engagement, where maybe 1 or 2 or 3% of the whole eligible population will actually enroll or engage in that service. That's kind of a scary number when you think about the overall prevalence of behavioral health conditions, which is much more like 1 in 5 Americans or, 1 in 4 lifetime prevalence for behavioral health diagnosis. And so, employers in general, they already know that they have to invest and they already do invest. They're already willing to invest. The question is, how much are they willing to invest and through which programs? And that's, I think, where the conversation gets a little bit more nuanced and where some of the things that Molly has highlighted in her article become much more relevant. Cost is only one side of the equation. And on the other side, there's the value of things like how many people use the program, or the value of how quickly can you get into treatment, or the value of what is the quality or the training or the credentials of the provider network that people can meet with. What are the tools or technologies that those providers have available to deliver that treatment? I think the question of willingness to invest is actually quite nuanced on the industry side of which programs they want to invest in and why.
So Adam, going on that, what type of programs should we invest in? If you were to decide for employers, what does that program look like? Where should they invest in?
I think what we've seen in the past 5 or 10 years is a trend towards some form of vendor consolidation, which is moving away from this kind of point solution approach where mental health services may be kind of federated out to several different vendors. You'll have one person who does the tobacco cessation. We'll have one vendor who does the higher forms of substance use. We'll have the health plan. We have the employee assistance program. We have someone who helps with financial stress. We might have a coaching program. We might have a caregiving program. We might have a mental health provider network. If you go back 5 or 10 years, there was really a tremendous amount of fragmentation. And what you've seen over the past 5 or 10 years is a trend towards behavioral health solutions that can kind of pull together much more of those programs into a more comprehensive solution. So that's one of them. A second thing that a lot of employers have really focused on is that top line engagement. How are we communicating the value of these programs? What is the modality of these? Are we still relying primarily on 1-800 numbers that feel clunky, that feel outdated compared to the other consumer products that you might use today? And so we've seen this trend away from primarily 1-800 number driven programs or call center driven programs towards these more digital solutions or digitally native solutions that look a lot more like the consumer products that you would use in other areas of your life, whether it's streaming entertainment online or whether it's buying groceries. There's been this huge shift towards consumerization of healthcare. And so I would say that those are 2 of the big things. And then the third is really the quality of the care. There's been a much higher attention and focus and scrutiny placed on the composition of that network. If you go back 10 years ago, most of the conversations were really how many providers do you have in your network? And I think that conversation has evolved tremendously away from I have 1,000 or I have 100,000 providers that have a certain license type in my network. What that used to mean was really that this is the agreed rate that these providers would take if a patient, showed up at their door. I think that conversation has evolved tremendously over the last 5 or 10 years to a point where there are many solutions that really put a significant amount of effort into curating the provider network, being more thoughtful about which providers they seek to recruit, which providers they actually recruit, what is the interview process that they have, what are the tools and technologies or the clinical standards that they enforce amongst their providers. And so that's why you've seen some companies that have a much more of a technology focus do a significantly better job in terms of developing and curating and managing the performance of a network of providers that are then held to much higher standards and then deliver much higher results when we look at clinical outcomes like reductions in PHQ-9s or time to remission, or financial outcomes like in the case of this JAMA open paper. around the financial ROI of participating in these programs.
Give me an example of what that solution looks like as someone who is an employee of an employer that is providing this service.
I think the first step is triage and figuring out what is going to benefit you the most, whether it be meditation, medication management, a new therapist. One of the biggest issues that we have in mental health care is engagement. So I recently partook in a study of telehealth versus in-person therapy for individuals with anxiety and depression, and the modal number of visits was 1. So most people were showing up and then dropping out. So I think the best thing that these platforms can do is improve the match between the employee and whatever type of treatment, whether it be more self-management, whether it be more guided with a therapist or even a psychiatrist, is going to keep them in care so that we can see an improvement in outcomes.
I would also add a lot of the innovation that's happened just around the user experience. So if we go to a traditional employee assistance program, you might call into a 1-800 number, you get bounced around a phone tree, eventually they call you back, you say, hey, I'm looking for treatment. They say, okay, here's 5 providers' phone numbers, you write them down, you call those providers, you ask them if they're taking new patients, most of them say no. You say, do you take my insurance or my EAP? You get some answer to that. And there's a tremendous amount of onus that's put onto that end user. Remember, these are people who are seeking behavioral health services as well. So they might be struggling with whether it's cognitive symptoms or stress or anxiety. The user experience with those solutions is quite poor. The other alternative is often the health plan. So if you go to your traditional health insurance provider, then sometimes they have websites where you can look through the provider registry. There have been many, many research studies, including a recent one in one of the JAMA journals as well, around these issues with ghost networks, right, where that information that's in these online registries is often incorrect or out of date, or that provider may not be practicing anymore. So there's significant friction with finding resources that way. And so what most people do is they'll just go to an online search engine. They throw in, I'm looking for a therapist in Brooklyn, and then they see what comes back. And that approach is also quite flawed because often those search results are ranked based on which vendor or which provider was paying the most for those ads. And so you end up with a kind of a perverse incentive matching process where the people who are most expensive are the ones who can afford to spend the most on customer acquisition or patient acquisition. And so you're not necessarily optimizing around the quality of care or necessarily what that patient needs. And the patient may not know what they need. They might, but they might not. And so those solutions generally have a lot of friction with the user experience. Whereas in the study that we published, the user experience, you would go to a website or a mobile app that is much easier to access. You would enroll where they check your eligibility. They just confirm the employer is sponsoring this benefit. It starts out with a structured assessment. So like Molly was saying, that triage is so important. So starts out with a structured assessment using these gold standard scales like the PHQ-9 for depression or the GAD-7 for anxiety or the audit for alcohol use disorders. We use that information to really match people into the right level of care or the right type of provider and figure out really what is the treatment program that is most likely to help that individual person get better. And then if they do need to book treatment, whether it's with a coach or a therapist or a medication provider or a substance use counselor, whatever it might be, then they can do that all through the platform as well. So all of those providers are in there, but all of the calendars are hooked up. You can actually see their availability in real time. And the average time to appointment is actually quite quick. It's more like same day, next day visits rather than the national average, which is more like 21 days, depending on the need and the type of care. So all of those kind of barriers have really been knocked down with that user experience, which makes it much, much easier for someone who does raise their hand and say that they need behavioral health services to actually get connected with a provider that is going to be a good match with them and set them up for success. There is a lot of research around these ideas like ghost networks. So essentially these online registries, typically referring to health plans. I think the recent JAMA study was around Medicaid providers, where they really showed just that the large amount of the information provided to end users on these websites. And when you go to your health insurance company, most of that provider information is either inaccurate or out of date, or those providers are inaccessible. And actually, even when they did manage to get through to the provider on the phone, most of those providers were not accepting new patients. And so you essentially run into this issue of what's called a ghost network, where there's kind of false access or misleading access to behavioral health services, because when you actually try and get into treatment with those providers, it's very challenging. So those networks are kind of positioning themselves as providing fast access to behavioral health or easy access to care that would be considered in network. But when users actually use those services, it's very challenging to get connected to a provider.
Do you feel that employees feel safe in these services? What do you see the future for this?
I'm excited. I think individuals have more options than ever. I think employers are incredibly invested, partly because we're seeing an increase in self insurance, which is when employers are managing their own risk pool and really investing in mental wellness. I think that a lot of the kind of macro indicators create cause for concern, more depression and anxiety, especially since COVID. But I think there's also a growing awareness, and I see this with my students around the need for mental health care. And one of the biggest challenges is getting folks to engage in that first encounter. So having a tool that's literally at their fingertips is really going to help matters.
I would agree. I would say that point that Molly makes about self-insured employers is really at the heart of this. Employers don't have a choice but to engage because they're already spending millions of dollars every year on direct behavioral health services, and often 10 or hundreds of millions of dollars, sometimes for the largest organization, billions of dollars a year on medical spend for their employees that they're self-insuring. And those costs are generally rising. And we see medical trend increasing across the board. And so organizations have to do something about it because this is something that's directly hitting their bottom line. And they just cannot afford for this inflationary environment and for the general healthcare costs of their employees to continue to go up in this way. They need to do something. They need to have strategies internally that help them optimize that care, that help them get the most bang for their buck for the healthcare dollars that they spend. And whether it's behavioral health, and in this case, something that has direct and very significant indirect spend, whether it's things like GLP-1s, which is now a rapidly rising direct spend, whether it's things like cancer as well, large employers all have entire teams that are really dedicated to understanding the space, understanding the needs of their employees, and putting together a portfolio of solutions that will ultimately help them get the best value for their healthcare dollars. So I would say that there's really no option to continue to put your head in the sand on this. It's a really expensive and growing problem.
Can I just add, they need to rigorously evaluate what they're rolling out. That quality improvement is so important when it comes to mental health care because at the beginning of a care journey, individuals have so many options: antidepressants, antipsychotics, different schools of therapy. If they're lucky enough to have a wide array of therapists and psychiatrists and network, then, finding the right person. And implementing quality improvement, rigorously evaluating programs like Spring Health is absolutely essential for us to be able to scale this. And I would just urge and commend employers to really invest in the research.
And does AI fix everything now with these new generative AI bots?
I would say, I'm really excited about the future of AI. I think at this point, we've all used the products and we've all seen. I think it's hard to imagine a world where there's less AI in the future. It's a new technology that appears really transformative. I would say, if you go back 10 years to when we were doing the original research that kind of was the impetus for founding Spring Health, and we had developed these treatment selection algorithms that would recommend specific treatments to patients or to give providers advice and recommendations about what kind of treatment is going to help people. I would say that even then, even 10 years ago, with tools that were way less powerful, with way less data, we were able to get really valuable insights by learning more about the patients that we've treated in the past to make better decisions moving forward. And I think that these new technologies around AI, for sure, there's going to be very straightforward improvements, whether it's back office efficiency, whether it's these operational improvements or automation that these tools seem incredibly powerful at. But I do think they're going to change the way that care is delivered, whether it's opening up a lower cost version of care that some people might find valuable, whether it's opening up or expanding the use cases, right? Not everyone needs therapy, not everyone needs medication, but maybe many people could benefit from engaging with these language models. And I think it's certainly already transformed a lot of the between session engagement that happens between a provider, a patient, and, in some case, the digital mental health platform that's facilitating the care. And so I think that it's like everything, and it's certainly like what Molly said, right? Ultimately, the proof is in the pudding, and we need to make sure that we do well-designed implementation studies and really look at the impact on clinical and financial outcomes, and even before that, things like safety and tolerability endpoints. But as long as we apply, I think, the frameworks that we know work well in medicine to this new technology, I don't see any world where we have less AI in the future. I think that the future is really exciting. I think it's going to open up a lot of new avenues and new use cases that this technology is going to unlock.
Great. Thank you so much.
Thanks. I would just say that AI is here to stay, and it's really exciting to see how it can be helpful with things like administrative burden, improving and optimizing the match between patient and treatment. But ultimately, a chatbot can't lose their license for providing low quality care. So, one thing we need to be very careful about is ensuring proper guardrails. Right now, if you go to ChatGPT and you display suicidal behaviors or ideation, they'll tell you that they're not a therapist and they'll send you to 988, and there's very little follow up. So, having kind of a robust infrastructure, and companies like Wobot are doing this well, to ensure that someone is getting the care that they need is really important. There was an article in the New York Times last week that focused on the American Psychological Association's take on AI. And one thing they pointed out, for example, is that AI tends to reinforce a user's beliefs as opposed to challenging a user's belief. Challenging a user's belief may be clinically appropriate for folks who are currently in crisis. So, as excited as I am about AI, I think a word of caution is also warranted.
I am Yulin Schwen, Associate Editor at JAMA and JAMA Plus AI, and I've been speaking with doctors Molly Candon and Adam Shekrud on the role of digital technologies in assisting mental health symptoms. You can find a link to the articles in this episode's description, and for more content like this, please visit our new JAMA Plus AI channel at jamaa.org. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Moreau at JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.